Happy Halloween, everybody. Welcome to the program. I'm Dr. Sanjay Gupta. The candy of our childhoods. Why do we still crave it every year at Halloween? Have you been dipping in already? We also got some serious business to get to. You've seen the pink ribbons all over this month, but we want to clear up some misconceptions about breast cancer. You know, you've seen the pink ribbons, the runs, the walks, but just how much do you know about breast cancer? It's a good time to talk about it. October is National Breast Cancer Awareness Month, and here to discuss the most common cancer for women is Dr. Valerie Montgomery Rice, Dean of the Morehouse School of Medicine. Thanks for joining us.
Thank you for having
It's
me.
really good to have you here in studio. This is a time to talk about breast cancer, although we could talk about it all the time. And you know,
yes.
And my mom had breast cancer, so this is something that I think about a lot as a son as well. First of all, when you think about family history, it's one of the first questions doctors like you always ask. How significant is family history?
It's significant in the fact that if a woman has a positive family history, we tend to think of first degree, whether it's their mother or their sister has breast cancer or was diagnosed. We want to ask them, was she diagnosed before she was age 50? That gives us a little bit more about the risk. But then that means that as a woman, you have about 2 times the risk of being diagnosed with breast cancer.
There's a lot of testing as far as genetic testing goes now. BRCA1, BRCA2, breast cancer 1 gene, breast cancer 2 gene. How significant is, I mean, first of all, who should get tested for this, and then what do you do with that information?
So the women that should get tested are women who have a history of breast cancer in their family, particularly if their mother had breast cancer at a young age, 20 to 30. They have a father who had breast cancer, prostate cancer, ovarian cancer. When you see the cancer running in the family, you think that there may be one of these mutations of these genes that you're describing. When a woman gets tested, though, we know that if she's positive, they have a mutation, she has about a 5-time greater chance of being diagnosed with breast cancer over her lifetime.
So you start to look at these things in aggregate. First of all, there are more women going to be diagnosed with breast cancer who have no family history, right?
Right, 85% or so.
85%. So that means, you know, you shouldn't take great solace in that you don't have a family history thinking, I don't need to get the screening test or to be examined. And as far as the breast cancer gene goes, it's not necessarily for everybody, but you got to know how to use it. If you're going to get the test, you got to have to know how to use the information.
The genetic counseling that goes with that is very important. If I tell you you have a positive mutation and I tell you have a 5 times likely chance of getting breast cancer than someone who doesn't, okay, then I have to tell you what you're going to do with that information.
That's right.
And most women make decisions based on what their doctor says. So the counseling is very important. And we want to counsel women that still the best thing we know to do is surveillance. Doing your self-breast examinations, having your annual mammogram. If you're younger than the age of 40 and you were to get this test and it was positive, what I would then do, of course, I would do MRI, I may do ultrasound, I may do some other things that are in a clinical trial or something where I'm getting more information for the woman, but again, surveillance, because we know that early detection makes the biggest difference.
Your typical patient, let's say has no family history, let's just say is in their late 30s and is coming to you for counseling. What age do you recommend someone like that start mammograms? Because there's been some controversy over that, as you know, recently as well.
So no risk factors like most women, other than they're a woman and they have breasts.
That's right.
Then I tell women, you're going to start your self-breast examination. I start that for women in their 20s, just so that they get comfortable with the procedure, doing their own self-breast examination. Because most women will find a mass on their own instead of the doctor finding it. So then what I'm going to do with this woman, I'm going to advise her at age 40, I want you to get your baseline mammogram. Every 2 years after that, I want you to get a mammogram. And then every month, though, you're doing your self-breast examination. You're seeing me once a year. I'm examining your breast. And then after age 50, we're going to start doing a mammogram every year.
You should know as well that my mom's doing great, and she's the beneficiary of a lot of the things that you're talking about. You know, a lot of people talk about this. Juliana Rancic recently, a host on the entertainment channel E, spoke very candidly about this. Take a listen.
Through my attempt to get pregnant for the 3rd time through IVF, we sadly found out that I have early stages of breast cancer. So. And it's been a shock.
She's only 36 years old. Her doctor suggested she have a mammogram, and that's when they found this. I mean, so what do you make of stories like that? Because obviously it's not to say that the advice that you give or anybody gives is wrong, but what about that? What do we take away?
Well, the good thing for her is that she did have the mammogram, and she has early diagnosed breast cancer, and so she should do pretty well, I hope. The challenge we have, though, is that we know that women under the age of 40 have what we call more dense breasts. And so if we do standard mammogram, then we have a higher chance of having a false positive. So we have to weigh that risk versus benefit. False positive meaning that I think I see something. I'm going to do an additional test that actually may cause you harm. So that's why we do mammograms starting at age 40 and doing them every 2 years. After age 50, we know doing them every year, we decrease our chances of having a false positive. That if I see something, then it actually means that there's something there that needs to be treated.
You know, you're terrific.
Thank you.
You're really, because this is a complicated matter for a lot of people, and it's serious, yet you made it really understandable, so thanks for being here.
Thank you
Will you
for
come
having
back?
me. I will. I would definitely come back.
All right, Dr. Rice, really terrific.